Hello everyone. Today, we're diving into the world of an antibiotic called gentamicin, commonly known by its brand names Garamycin, Cidomycin, and Jenamicin. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Gentamicin, recognized by its brand names Garamycin, Cidomycin, and Jenamicin, is an aminoglycoside antibiotic. It's typically used to treat severe bacterial infections, particularly those caused by gram-negative bacteria. Gentamicin works by inhibiting bacterial protein synthesis, which ultimately leads to the death of the bacteria. It is administered via injection, either intravenously or intramuscularly, and is often reserved for serious infections where other antibiotics may not be effective. It's commonly prescribed for infections like sepsis, respiratory tract infections, urinary tract infections, intra-abdominal infections, and skin infections. Warnings: Gentamicin comes with several important precautions. It can cause nephrotoxicity, kidney damage, and ototoxicity, hearing loss. It's crucial to monitor kidney function and hearing during treatment. Gentamicin is not recommended for patients with pre-existing kidney disease or hearing issues unless absolutely necessary and under close medical supervision. Pregnant women should avoid gentamicin as it may harm the fetus. It's also essential to use this antibiotic cautiously in elderly patients and those with dehydration or other conditions that affect kidney function. Before taking this medicine. Before starting gentamicin, several factors need consideration. Inform your healthcare provider if you're allergic to gentamicin or any other aminoglycoside antibiotics. Given its impact on the kidneys and hearing, those with kidney diseases, hearing problems, or balance issues should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. It's also important to tell your doctor if you have any neuromuscular disorders such as myasthenia gravis or Parkinson's disease, as gentamicin may exacerbate muscle weakness. Inform your healthcare provider about any surgeries you have scheduled, as gentamicin might be used as a preventive measure during surgery but requires careful monitoring. Side effects: all medications can have side effects, and gentamicin is no exception. Some individuals might experience nausea, vomiting, or loss of appetite. More severe side effects include kidney problems, characterized by reduced urine output, swelling, and fatigue. Hearing issues, such as ringing in the ears, tinnitus, or hearing loss, and balance problems can also occur. These side effects are often associated with prolonged use or higher doses of gentamicin. Additionally, gentamicin can cause allergic reactions, including rash, itching, swelling, severe dizziness, and trouble breathing. In rare cases, it may lead to serious neuromuscular issues, manifesting as muscle weakness or respiratory difficulties. Immediate medical attention is required if any of these severe side effects occur. Interactions: gentamicin might interact with other medications, particularly those that also affect kidney function or hearing. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Notably, other nephrotoxic or ototoxic drugs, such as certain diuretics and other antibiotics, should be used cautiously with gentamicin. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking gentamicin. The dosage is typically based on the type and severity of the infection, as well as the patient's kidney function and overall health. Regular monitoring of drug levels in the blood, kidney function, and hearing is essential to ensure safety and efficacy. Dosage adjustments may be necessary based on these monitoring results. For most severe infections, gentamicin is administered in divided doses throughout the day. The typical dosage for adults is 3 to 5 mg/kg/day, divided into 2 to 3 doses. For pediatric patients, the dosage is calculated based on body weight, and close monitoring is especially critical. Avoid: while on gentamicin, it's advisable to stay hydrated to support kidney function. Avoid other medications that can harm the kidneys or hearing unless specifically approved by your healthcare provider. If you experience dizziness or balance issues, avoid activities that require alertness, such as driving or operating machinery. FAQ: many wonder about the duration of gentamicin treatment. Typically, the treatment course is kept as short as possible to minimize the risk of side effects, often ranging from 7 to 10 days. However, the exact duration depends on the infection's severity and response to the antibiotic. Always follow your healthcare provider's instructions. Closing. That wraps up our overview of gentamicin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.